Assessment of a client with a cast should include: A. Capillary refill, warm toes, no discomfort. B. Posterior tibial pulses, warm toes. C. Moist skin essential, pain threshold. D. Discomfort of the metacarpals. Question 1 answer: A. Capillary refill, warm toes, no discomfort. Question 1 explanation: assessment for adequate circulation is necessary. Signs of impaired circulation include slow capillary refill, cool fingers or toes, and pain. Question 2. When the nurse is determining the appropriate size of an oropharyngeal airway to insert, what part of a client's body should she measure? A. Corner of the mouth to the tragus of the ear. B. Corner of the eye to the top of the ear. C. Tip of the chin to the sternum. D. Tip of the nose to the earlobe. Question 2 answer: A. Corner of the mouth to the tragus of the ear. Question 2 explanation: an oropharyngeal airway is measured from the corner of the client's mouth to the tragus of the ear. Question 3. All of the following factors, when identified in the history of a family, are correlated with poverty except: A. High infant mortality rate. B. Frequent use of emergency departments. C. Consultation with folk healers. D. Low incidence of dental problems. Question 3 answer: D. Low incidence of dental problems. Question 3 explanation: dental problems are prevalent because of the lack of preventive care and access to care. High infant mortality is one of the most significant problems correlated with poverty. Pregnant women who do not have access to care might come to the emergency department when in labor. Those in poverty are likely to use emergency departments because they may not be turned away. Those in poverty might also turn to folk healers or other persons in their community for care who might be easier to access and might not demand payment. Question 4. Teaching about the need to avoid foods high in potassium is most important for which client? A. A client receiving diuretic therapy. B. A client with an ileostomy. C. A client with metabolic alkalosis. D. A client with renal disease. Question 4 answer: D. A client with renal disease. Question 4 explanation: clients with renal disease are predisposed to hyperkalemia and should avoid foods high in potassium. Choices 1, 2, and 3 are incorrect because clients receiving diuretics with ileostomy or with metabolic alkalosis are at risk for hypokalemia and should be encouraged to eat foods high in potassium. Question 5. Which of the following nursing diagnoses might be appropriate as Parkinson's disease progresses and complications develop? A. Impaired physical mobility. B. Dysreflexia. C. Hypothermia. D. Impaired dentition. Question 5 answer: A. Impaired physical mobility. Question 5 explanation: the client with Parkinson's disease can develop a shuffling gait and rigidity, causing impaired physical mobility. The other diagnoses do not necessarily relate to a client with Parkinson's disease. Question 6. A client turns her ankle. She is diagnosed as having a pulled ligament. This should be documented as A. Sprain. B. Strain. C. Subluxation. D. Distoration. Question 6 answer: B. Strain. Question 6 explanation: a strain is excessive stretching of a ligament. A sprain involves a twisting motion involving muscles. Question 7. Acyclovir is the drug of choice for: A. HIV. B. HSV1 and 2 and VCV. C. CMV. D. Influenza viruses. Question 7 answer: B. HSV1 and 2 and VCV. Question 7 explanation: Acyclovir, Zovirax, is specific for treatment of herpes virus infections. There is no cure for herpes. Acyclovir is excreted unchanged in the urine and therefore must be used cautiously in the presence of renal impairment. Drugs that treat herpes inhibit viral DNA replication by competing with viral substrates to form shorter, ineffective DNA chains. Question 8. The kind of man who beats a woman is: A. From a minority culture in a low-income group. B. From a majority culture in a middle-income group. C. One who was never allowed to compete as a child. D. From any walk of life, race, income group, or profession. Question 8. Answer: D. From any walk of life, race, income group, or profession. Question 8. Explanation: Batterers cannot be predicted by demographic features related to age, ethnicity, race, religious denomination, education, socioeconomic status, or class. 95% of domestic abuse cases involve male perpetrators and female victims. Question 9. The major electrolytes in the extracellular fluid are: A. Potassium and chloride. B. Potassium and phosphate. C. Sodium and chloride. D. Sodium and phosphate. Question 9. Answer: C. Sodium and chloride. Question 9. Explanation: Sodium and chloride are the major electrolytes in the extracellular fluid. Question 10. When administering intravenous electrolyte solution, the nurse should take which of the following precautions? A. Infuse hypertonic solutions rapidly. B. Mix no more than 80 mg of potassium per liter of fluid. C. Prevent infiltration of calcium, which causes tissue necrosis and sloughing. D. As appropriate, re-evaluate the client's digitalis dosage. He might need an increased dosage because 4 calcium diminishes digitalis's action. Question 10. Answer: C. Prevent infiltration of calcium, which causes tissue necrosis and sloughing. Question 10. Explanation: Preventing tissue infiltration is important to avoid tissue necrosis. Choice 1 is incorrect because hypertonic solutions should be infused cautiously and checked with the RN if there is a concern. Choice 2 is incorrect because potassium, mixed in the pharmacy per physician order, is mixed at a concentration no higher than 60 mg/L. Question 11. For a client with suspected appendicitis, the nurse should expect to find abdominal tenderness in which quadrant? A. Upper right. B. Upper left. C. Lower right. D. Lower left. Question 11. Answer: C. Lower right. Question 11. Explanation: The nurse should expect to find abdominal tenderness in the lower right quadrant in a client with appendicitis. Question 12. Which of the following statements, if made by the parents of a newborn, does not indicate a need for further teaching about cord care? A. I should put alcohol on my baby's cord 3 to 4 times a day. B. I should put the baby's diaper on so that it covers the cord. C. I should call the physician if the cord becomes stark. D. I should wash my hands before and after I take care of the cord. Question 12. Answer: D. I should wash my hands before and after I take care of the cord. Question 12. Explanation: Parents should be taught to wash their hands before and after providing cord care. This prevents transferring pathogens to and from the cord. Folding the diaper below the cord exposes the cord to air and allows for drying. It also prevents wet or soiled diapers from coming into contact with the cord. Current recommendations include cleaning the area around the cord 3 to 4 times a day with a cotton swab but do not include putting alcohol or other antimicrobials on the cord. It is normal for the cord to turn dark as it dries. Question 13. Which of the following diseases or conditions is least likely to be associated with increased potential for bleeding? A. Metastatic liver cancer. B. Gram-negative septicemia. C. Pernicious anemia. D. Iron deficiency anemia. Question 13. Answer: C. Pernicious anemia. Question 13. Explanation: Pernicious anemia results from vitamin B12 deficiency due to lack of intrinsic factor. This can result from inadequate dietary intake, faulty absorption from the GI tract due to a lack of secretion of intrinsic factor normally produced by gastric mucosal cells, and certain disorders of the small intestine that impair absorption. The nurse should instruct the client in the need for lifelong replacement of vitamin B12, as well as the need for folic acid, rest, diet, and support. Question 14. Teaching the client with gonorrhea how to prevent reinfection and further spread is an example of A. Primary prevention, B. Secondary prevention, C. Tertiary prevention, D. Primary healthcare prevention. Question 14. Answer: B. Secondary prevention. Question 14. Explanation: Secondary prevention targets the reduction of disease prevalence and disease morbidity through the early diagnosis and treatment. Question 15. Which of the following methods of contraception is able to reduce the transmission of HIV and other STDs? A. Intrauterine device, IUD. B. Norplant. C. Oral contraceptives. D. Vaginal sponge. Question 15. Answer: D. Vaginal sponge. Question 15. Explanation: The vaginal sponge is a barrier method of contraception that, when used with foam or jelly contraception, reduces the transmission of HIV and other STDs as well as reducing the risk of pregnancy. IUDs, Norplant, and oral contraceptives can prevent pregnancy but not the transmission HIV and STDs. Clients using the contraceptive methods in choices 1, 2, and 3 should be counseled to use a chemical or barrier contraceptive to decrease transmission of HIV or STDs. Question 16. Following a classic cholecystectomy resection for multiple stones, the PACU nurse observes a serasanguious drainage on the dressing. The most appropriate intervention is to A. Notify the physician of the drainage. B. Change the dressing. C. Reinforce the dressing. D. Apply an abdominal binder. Question 16. Answer: C. Reinforce the dressing. Question 16. Explanation: Serasanguious drainage is expected at this time. The dressing should be reinforced. Changing a new post-op dressing increases the risk of infection. An abdominal binder interferes with visualization of the dressing. Question 17. Which sign might the nurse see in a client with a high ammonia level? A. Coma. B. Edema. C. Hypoxia. D. Polyuria. Question 17. Answer: A. Coma. Question 17. Explanation: Coma might be seen in a client with a high ammonia level. Question 18. A 10-month-old child is brought to the emergency department because he is difficult to awaken. The nurse notes bruises on both upper arms. These findings are most consistent with A. Wearing clothing that is too small for the child. B. The child being shaken. C. Falling while learning to walk. D. Parents trying to awaken the child. Question 18. Answer: B. The child being shaken. Question 18. Explanation: Children who are shaken are frequently grasped by both upper arms. Symptoms of brain injury associated with shaking include decreased level of consciousness. Question 19. For which of the following conditions might blood be drawn for uric acid level? A. Asthma. B. Gout. C. Diverticulitis. D. Meningitis. Question 19. Answer: B. Gout. Question 19. Explanation: Uric acid levels are indicated for clients with gout. Question 20. Which of the following might be an appropriate nursing diagnosis for an epileptic client? A. Dysreflexia. B. Risk for injury. C. Urinary retention. D. Unbalanced nutrition. Question 20. Answer: B. Risk for injury. Question 20. Explanation: The epileptic client is at risk for injury due to the complications of seizure activity, such as possible head trauma associated with a fall. The other choices are not related to the question. Question 21. A client is complaining of difficulty walking secondary to a mass in the foot. The nurse should document this finding as A. Plantar fasciitis, B. Hallux valgus, C. Hammerdoe, D. Morton's neuroma. Question 21. Answer: D. Morton's neuroma. Question 21. Explanation: Morton's neuroma is a small mass or tumor in a digital nerve of the foot. Hallux valgus is referred to in lay terms as a bunion. Hammertoe is where one toe is cocked up over another toe. Plantar fasciitis is an inflammation of, or pain in, the arch of the foot. Question 22. Which of the following injuries, if demonstrated by a client entering the emergency department, is the highest priority? A. Open leg fracture, B. Open head injury, C. Stab wound to the chest, D. Traumatic amputation of a thumb. Question 22. Answer: C. Stab wound to the chest. Question 22. Explanation: a stab wound to the chest might result in lung collapse and mediastinal shift that, if untreated, could lead to death. Treatment of an obstructed airway or a chest wound is a higher priority than hemorrhage. The principle of ABC, airway, breathing, and circulation, prioritizes care decisions. Question 23. When a client needs oxygen therapy, what is the highest flow rate that oxygen can be delivered via nasal cannula? A. 2 liters a minute, B. 4 liters a minute, C. 6 liters a minute, D. 8 liters a minute. Question 23. Answer: C. 6 liters a minute. Question 23. Explanation: the highest flow rate that oxygen can be delivered via nasal cannula is 6 liters a minute. Higher flow rates must be delivered by mask. Question 24. A woman asks, how much alcohol can I safely drink while pregnant? The nurse's best response is A. The amount of alcohol that is safe during pregnancy is unknown. B. Consuming 1 or 2 beers or glasses of wine a day is considered safe for a healthy pregnant woman. C. Drinking 3 or more drinks on any given occasion is the only harmful type of drinking during pregnancy. D. You can have a drink to help you relax and get to sleep at night. Question 24. Answer: A. The amount of alcohol that is safe during pregnancy is unknown. Question 24. Explanation: the amount of alcohol that is safe during pregnancy is unknown. Fetal alcohol syndrome is a combination of mental and physical abnormalities present in infants born to mothers who have consumed alcohol during pregnancy. Question 25. The nurse is assessing the dental status of an 18-month-old child. How many teeth should the nurse expect to examine? A. 6, B. 8, C. 12, D. 16. Question 25. Answer: C. 12. Question 25. Explanation: in general, children begin dentition around 6 months of age. During the first 2 years of life, a quick guide to the number of teeth a child should have is as follows: subtract the number 6 from the number of months in the age of the child. In this example, the child is 18 months old, so the formula is 18 minus 6 equals 12. An 18-month-old child should have approximately 12 teeth.